Every minute in the world, someone dies of coronary artery disease. Coronary artery disease is also called ischemic heart disease. Ischemic heart disease occurs when the blood vessels that supply the heart is narrowed by cholesterol or bad lipids and narrows these blood vessels, that blood supply to the heart is no longer sufficient for the heart to carry out its metabolic function. That is when we say that coronary heart disease has occurred. Now, most of the symptoms is severe chest pain. You feel like tightness and heaviness in the chest. The pain can radiate to the jaw, to the tip of the shoulder, and to the inner part of the left arm. The pain is always very severe. So I'll go on to mention some of the risk factors. One will be positive family history. So if a relative has coronary artery disease, most especially at a younger age, the risk of members of that family having coronary artery disease is high. Two is male sex. The other is consumption of alcohol, smoking or cigarette, diabetes mellitus, hypertension, then abnormalities of lipids, that is increase in cholesterol levels, not eating enough vegetables and fruits, physical inactivity, that means you don't have an exercise regimen, you do not exercise, then abdominal fat, pot belly. So you see, if you are a male, you smoke, you drink alcohol, you may not escape having coronary artery disease. You are a male, you smoke, you drink alcohol, and you have fat belly or pot belly, you may not escape having coronary artery disease. You are a male, you have pot belly, you smoke, you drink alcohol, you don't have exercise regimen, then that is a serious problem. So, what do we do to avert having coronary artery disease? So, first and foremost, we must try to avoid these risk factors. These risk factors are modifiable. That is why that is a good thing actually. You can stop smoking, you can stop taking alcohol, you can have an exercise regimen to burn up fat, and you can always do a regular checks of your blood pressure and your sugar levels. So by so doing, you can reduce your chances of having coronary artery disease, even if there's a family history of coronary artery disease. So observing these modifications will help you and go a long way to avoiding these problems. Have a great day.